Greetings from Advanced Fertility and Gynae Center. Today we are going to talk about an important topic, which is the COVID virus, vaccination, pregnancy, lactation, and what about the couples who are trying to conceive, and what about vaccination for them. So before we start, I want to uh, greet all mothers. We recently had Mother's Day on the 9th of May. So, wish you a very happy Mother's Day to all our beautiful mothers who have already become mothers, who are planning to become mothers, who are in the process. And it's a divine gift of nature, I feel, motherhood. And for me, every day is a Mother's Day. And many, many happy Mother's Day to all my listeners. So I'm going to run through a few questions which many of my patients ask me, and then let's see what we can come up with their answers. So there's a lot of concern about COVID-19 virus in pregnancy. So please share your thoughts on this. Do you think we should continue with pregnancy or planned pregnancy? So let's see what is the consensus. Now, COVID-19 infection is usually, it can be mild, moderate, or severe. So, if you get pregnant and if you get the virus, it's not that pregnant women are at an increased incidence of getting. Again, majority have the mild category. So, you have fever, you have sore throat, it's managed at home. Very few, about 5 to 10% need critical care, and more than 90% recover from this critical care. A note of caution is about the new strains that are currently creating havoc in the country. There has been noticed to be a slightly higher incidence of respiratory problems in pregnant women and more need of intensive support, and the pregnant women are needing some more time to recover. This is the case with non-pregnant women and men also. Seems to be quite a virulent strain this time. Incidence of preterm delivery, delivery before time, is slightly high, and there is no increased risk of miscarriage or any congenital malformations due to COVID, uh, according to all the studies so far. Now, what precautions would you advise the pregnant women during the pandemic? So, you become pregnant, what should you do? Of course, we must maintain all the social distancing, hand hygiene, double masking principles religiously. Whether it is now at the peak or when it gets down or later, I think these few things are here to stay, and they, especially pregnant women, have to maintain it. Diet with all vitamins is very important. Rest is very important. Stress is to be reduced, and deep breathing exercises, all these to improve your immunity power and to bring relaxation and also to improve the oxygenating capacity of your lungs. If you get the symptoms, you must immediately isolate yourself, consult your doctor, and if the symptoms worsen, you must be hospitalized. Should you be vaccinated? If you're pregnant, should you get the COVID vaccine? Now, none of these viruses are vaccines are live vaccines. So there should not be any risk of getting COVID because of the vaccination. However, no sufficient data available for pregnant women regarding risk and side effects because the studies of vaccines have not been done on so many pregnant women. However, the international guidelines strongly consider vaccination in pregnant women especially when there is high infection rate as is happening now in our country, advanced maternal age, and associated comorbidities like diabetes and obesity. The National Federation of Obs and Gynae has urged the government to allow vaccination in pregnancy, especially in high-risk groups, and soon it will be allowed. A study conducted regarding acceptance of vaccines in various women, Indian, Malaysian, and other countries have found that Indian women are not averse to get vaccination, the pregnant women. So the overall answer is, I think, yes. But we have to wait for the government guidelines to come through, which we are expecting very soon. Now, you have had the virus, you were pregnant, how will it affect your baby? Now, the good news is that if you've had COVID, the chance that your baby will also get COVID is very low. No suggestion that the virus causes any malformation or increased problems to newborn, except slightly higher incidence of delivering before time. The new virulent strain, especially in those women who have developed severe COVID and are not able to get health care, there is slightly higher incidence of stillbirth. Now, what is the direction regarding breastfeeding if the mother is COVID positive? Now, WHO says that the benefits of breastfeeding far outweigh the risk of transmitting to the baby. If you choose with strict hand hygiene measures, double masking, and keeping the baby separate when you're not breastfeeding, all these methods should be practiced if you want to continue breastfeeding and the virus is not transmitted through the breast milk. What about vaccinating women who are breastfeeding? Again, like in pregnant women, in breastfeeding women, safety studies have not been carried out to such a large number, but studies have demonstrated benefit of transmission of antibody through the breast milk to the baby. So that's a big benefit. And especially in areas with high infectivity and associated comorbidities, the lady must be vaccinated. What type of vaccine is best? There's so many vaccines in the market and none of them are live vaccines. Most are safe and efficacious and majority have shown close to 80 to 85% safety rates. One of the vaccine, the Covishield AstraZeneca, has shown a very rare side effect called vaccine-induced idiopathic thrombotic thrombocytopenia, in which you have blood clots and can lead to severe problem, but the incidence is very, very low. And some people have suggested that maybe in younger population, other options may be suggested. Now, what would you advise couples who are trying to get pregnant in the pandemic? Now, COVID started in 19, it is 21 now. Should you get pregnant? Should you just hold off getting pregnant, say till you're very sure? How long are you going to think in those lines? As we know, the course of the pandemic is highly unpredictable. Studies have indicated that the virus or the vaccine does not have any effect on fertility so far. You don't get infertile if you get COVID, nor if you get the vaccine, and you can continue your pregnancy plans while you are planning to get the vaccine also. So you cannot delay the process indefinitely, especially who wish to start the family, who have advanced stage, who have dealt with infertility. All the guidelines must be followed and please get yourself vaccinated. Can the vaccine be taken during fertility like IUI, IVF? Yes, you can take it during treatment. It is sensible to separate the date of vaccination by a few days from treatment procedure like egg collection, because any symptoms like fever may be wrongly attributed to the vaccine and not the treatment procedure. I mean, may be attributed to the vaccine. So, if you do it during the egg pickup and you get the fever because of an infection, people will say it is because of the vaccine. So, you should not take it during the main procedures. And definitely, unnecessary delay of treatment should not be advised to women who are more than 35 years of age. With this, I sincerely hope that this pandemic ends soon. Please stay safe. Please follow all precautions and please do get vaccinated. Thank you very much.